can speak in English.
The meeting of the Atlantic County Board of Freeholders is called to order. In compliance with the Open Public Meetings Act of the State of New Jersey, adequate notice of this meeting of the Atlantic County Board of Chosen Freeholders was provided in the following manner: published in the Press of Atlantic City and mailed to the Current, the Daily Journal, the Hamilton Gazette, and the Hamilton News, and has been posted on the bulletin boards in the County Office Building in Atlantic City, the Stillwater Building in Northfield, and the County Clerk's Office in Mays Landing. All rise, please, for an opening prayer and the Pledge of Allegiance.
Gracious and loving God, we give you thanks for the dream of what America could be, for the freedom to think, speak, and worship as we choose. We give you thanks for the human endeavor that enables us to share rights with others even though we may disagree. We give thanks for richly endowing this land with prosperity and abundance. May we continue to share your blessings with others, that all the world may be as you have dreamed it will be. Amen.
Amen. Attention, salute.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, roll call, please.
Chairwoman Gatto, Freeholder Ricino is ill. He will not be here today.
Okay, thank you.
Bennett?
Here.
Corsi? Days?
Here.
Fitzpatrick?
Here.
Formica?
Here.
Kern?
Here.
Risley?
Here.
And Gatto.
Here. Okay, you've all had the opportunity to review the minutes from January 15th. If there are no corrections, I'll entertain a motion to adopt.
Move.
Motion?
Second.
Second. Any questions or comments? All those in favor?
Aye.
Aye. Any opposed? Any abstentions? Okay, next we will go into our printed agenda. Before we start off with our first presentation, I just want to welcome, we have two students here from Oakcrest High School. Paige and Deanna are back there from the media department, and their teacher, Chip Lockwood, is a gentleman on the side here. They are doing a story on the Freeholders, and I'm an alum, so I get to be featured. That's pretty exciting. So thank you guys for coming. We appreciate it. Okay, so first up on our agenda is a presentation. Bob, you want to come on up and get us started?
Thank you very much, Freeholder Board, for having me here today. My name is Bob Widitz. I'm the County Director of Substance Abuse Services and the Director of the Intoxicated Driver Resource Center. I was invited here today to do a short, well, first it was a presentation, then we thought it was a demonstration, now we're back to a presentation. In order to do a full demonstration and a training, it would take 45 minutes to an hour. So basically I'm just going to give you some idea of what we're doing and what's going on, some handouts that I gave to you and where we're at and where we propose to go. Besides introducing myself, I'd like to introduce Jennifer Peelhout. Jennifer is the new Alliance Coordinator, and as the Alliance Coordinator will be spearheading the re-entry into the Narcan naloxone training program for the opiate overdose recovery. Also with us is George Dannenhauer. I mix it up all the time. George just came to us recently. He was with the Try It program, which lost its funding, and the county was nice enough to find a place for him. We had an opening in our unit, so George has come on board as another one of our counselors, and will also be working with the program. So, thanks.
And Bob, before you start, I should have actually, as Freeholder Formica was the one who actually wanted to have us on the agenda. So Freeholder, did you want to make any comments before we start?
Not at all. Glad you made the time to get here, and all I can say is that it's become quite apparent how important this is, our coordination with the county fighting opioid addiction and treatment. And it's sometime in the future, I would like for the whole board to take the full training so that we're qualified. And as I understand, we should also have a training in CPR, because a lot of times after it's administered, you still got to get them going. So that would be great. We would all like to do that. Maybe not at one of our meetings, but offer us the time to do it so we could all carry Narcan ourselves.
And I'll talk a little bit about that in ways that we can do it quite easily. But going to what I have for you today, basically you have a handout packet there, you know, and I wanted to just briefly go over what's in the packet. The first thing is a summary of the New Jersey Overdose Prevention Act, which was signed by Governor Christie in May of 2013. And basically, the gist of the whole thing is that anyone who has taken the training can administer Narcan for an opiate overdose recovery. And there is no civil or criminal liability attached to it. It's similar to the Good Samaritan Act that was also enacted, whereby if an individual is at a party somewhere and someone overdoses, they can call for help and they're not going to be held, even if they're part of that party and possibly using. It's more important to get the help there. That's the Good Samaritan. This is similar, but as I said, basically anyone administering Narcan who has had the training rather, is not liable civilly or criminally for any of the actions. So, the second piece of paper, what do you do and what don't you do if you're faced with an opiate overdose? You know, check your surroundings and make sure it's safe. Call 911 for help. That's the most important thing. You need to make that call immediately. Checks for signs of overdose. Support the person's breathing. I'll talk a little bit about. That's one of the things that we train in the training is rescue breathing, because it's extremely important. All right. Administer the naloxone, and Narcan is just another name for the naloxone. Monitor the person's responses and stay with them until help arrives. The things that you don't want to do, you know, try to handle the situation on your own. You never want to leave them alone. You don't throw ice or water on them. Inject them with anything, put them in a shower, force them to eat or drink, attempt to make them vomit, or let them sleep it off. Those kinds of things are going nowhere, because usually with an opiate overdose, if you go to the next page, which is the naloxone fact sheet, basically an opiate can slow or stop a person's breathing, and the naloxone or the Narcan is what helps the person to wake up and continue breathing. So, you know, naloxone is a prescription medication that's used to reverse an opiate overdose. Opiates include heroin and prescription pain medications such as morphine, hydrocodone, and oxycodone. So, naloxone is safe and effective. Medical professionals have used it for decades. And naloxone also goes by the brand names of Narcan or Avizio, okay? So this, you know, tells you a little bit about naloxone itself. Most people have no idea what Narcan or naloxone is, so I included it in the packet. And I know that each of the freeholders have a packet. There are also extra packets out on the table with the agenda if anyone is interested. The next page is, you know, how do you administer? And this is where we talk about, the main thing is usually when you come upon these people, they're either unconscious and or not breathing. So the first thing you want to do is administer the rescue breaths. Rescue breaths are like 2 normal breaths every 5 to 7 seconds, 5 to 10 seconds. You want to do that. If they do not respond, then at that point you administer the naloxone. The naloxone should, or the Narcan as we more commonly know it, should respond, the person should respond within 5 minutes. Okay. If they do not respond in 5 minutes, you administer again the rescue breathing, and if available, you give them a second dose of the Narcan. You stay with them, you continue to rescue breathing until the emergency personnel get there. So this is just a brief, quick and easy, you know, on the guidelines for the administration of the naloxone. A very easy process, and I'll talk a little bit more about it later. One of the other things that I have in the packet, the Freeholder Board was extremely, extremely helpful in encouraging us to include Narcan kits in all of the AED stations in the county. That came along with the county executive and administration giving us the okay. You have a complete list of all of the facilities in the county that currently have Narcan kits in them, all right? The funny thing about it was when we started this program, we were so excited about doing it, we got those kits out there immediately and then realized that we had to pull them out because we hadn't trained anyone yet to use them. So we got the training done pretty quickly, put the things back, and they've been there ever since. We check them periodically, but we now also have Vince Jones, who's out there, who's our guy out in emergency management, who's checking them for us and lets us know if any of them are expired. As you can see, most of them are good. We have a couple that are coming up for expiration in July of this year, so we'll be replacing them certainly before they do expire. One of the other things that I have there, and you see it up here, we did this just in case program. We actually got an intern from Stockton University who came on board, and along with Charlie Curley, our former Alliance coordinator, they put together this program just in case, or you or someone you love at risk of a heroin opiate overdose. This is actually in much nicer colors. We have a color brochure that we put out, one side English, one side Spanish. But again, the naloxone kit that you see here, which would be orange in color, I'll talk a little bit more about that as we go on because it's much bigger than the kits that we're using right now. And the last thing that I have in the packet basically is Governor Murphy came on board and decided, this is a major epidemic that needs continual addressing, and you have a list of all the initiatives or all the programs that Governor Murphy has either brought on board or has continued through his administration. So again, I just put the packet together for information purposes so you know a little bit about naloxone, a little bit about the program and what's going on. What I'd like to do is basically tell you, how did we get started and what happened. The original grant, the Opiate Overdose Recovery Act program, rather, Atlantic County, John Brooks Recovery Center had the original grant through the state. When John Brooks made all their plans to move into a new building and whatnot, they decided not to renew. Urban Treatment out of Camden County then got the state grant for southern New Jersey. Through Urban Treatment, we get 15 trainings a year with a maximum of 20 people per training. That's 300 people max that we can train during the course of a year. We decided that that wasn't enough. So basically we went to the Governor's Council on Alcoholism and Drug Abuse, which is our prevention grant, and said we'd like to use some of the county-wide programming money to expand this program. They came back to me and they say, what does that have to do with prevention? I said, we're preventing people from dying. And lo and behold, they turned around and said, we agree. So we got to use some of the monies from the countywide portion of the Municipal Alliance grant to purchase Narcan and to expand the program. And I want to give you an idea of just what we did. That happened, the initial request went out in 2016, but we got the okay in 2017. In 2017, we worked jointly with Urban Treatment to provide 17 direct Narcan trainings. 230 individuals throughout the county received the training. We ourselves provided an additional 22 trainings, wherein 285 individuals were trained. And through these trainings, over 255 people actually received the overdose kits. Some of the trainings we did like at schools, or we did at lifeguards or places like that, where maybe we gave them, we trained 10, 12, 15 people, but we only gave them 2 or 3 of the kits to place, in different locations. So that was 2017. In 2018, unfortunately, I lost Charlie Curley. He was only here for 9 months of the year and decided he was going to retire and enjoy life. But we still were able to work jointly with Urban Treatment. We provided 4 trainings in coordination with them, whereby 45 individuals were trained. But we also provided ourselves 16 additional Narcan trainings, where an additional 199 people were trained. overdose reversal kits were distributed to individuals, school district personnel, county offices, local police departments, the sheriff's department, and believe it or not, the New Jersey State Police who came to us, and we trained some of their people. So basically that's how we got started. But I wanted to talk also a little bit, and you'll excuse me if I'm rushing through. I don't want to take a lot of your time. I know you've got a full agenda. Here in the county, we've also been involved. We have the Opiate Task Force, which is run jointly through the prosecutor's office and JTAC, which is joined together Atlantic County, our prevention coalition. And we have members who sit on that board. We actually trained the people at the Sheriff's Department for the Hope One van. They now have Narcan on the van. They can respond directly while they're out in the communities. If there happens to be an overdose situation, they can respond. The other thing about it is the prosecutor is now charged through the Attorney General with training the police departments. They didn't have a prescription for Narcan. They came to us. We had this standing prescription, which we got through Ocean County, through a physician in Ocean County, and we were able to get them the Narcan to get their program started for training in the police departments. One of the things that I really want to talk about, though, and one of the things that kind of has us right now in a bind, we're looking now at expanding the amount of money that we're getting from the Governor's Council. We found that we are not expending the total amount allowed for county-wide programming, so we may have another $4,000 to $5,000 there. Also, the Lakota this past week voted to set aside $10,000 of the Chapter 51 funding for Narcan. So we may have between $10,000 and $15,000 to go out and purchase additional Narcan. Where we are right now is, since Charlie left, we've kind of put things on hold, but we also right now only have 35 kits available. One of the biggest problems is the cost of the Narcan. And it's not training the new people, it's replacing Narcan that's either expired or has been used by someone. Anyone who does a training with us, we keep a record of it. We number all of the Narcan kits so that we know that they've been with us. And if that in fact has happened, then we will replace the Narcan for them if it either expires or is used. The Narcan itself, for a 2-dose package, it cost us $75. But I want you to know, at the last Opiate Task Force meeting, the pharmacists out there who can prescribe the Narcan are paying $150 for the same 2-dose package. Well, one of the initiatives that Governor Murphy has is making the Narcan more readily available. So we'll be exploring that as well to see exactly what they're talking about and what's going on. The thing is, we definitely want to get the program back up and running. We definitely want to continue the program as long as we can. We now have a new individual on staff as well, so if I get 2 or more people trained, we can hit more places, both day and evening. One of the things, though, that we did, just so you know, as I said, if you saw the big orange kit that's in the AED box, it's about this big. This is what we have now, all right? And it's smaller because it includes the rubber gloves, okay? It includes the breathing shield, and it includes 1 dose of Narcan, all right? We did that so that we could get as many people trained as possible, so that we spread it out as much as we could. Ideally, I'd love to be able to have 2 doses. The reason being this: quite often today, with the heroin that we have out there, the purest and cheapest anywhere in the country, coupled with the fentanyl, a lot of times people do not respond to 1 single dose. And if it takes that EMT or that emergency emergency person to get there, a little bit of time to get there, we may have to, administer that second dose. So ideally, I'd love to be able to put 2 doses in each kit. If we get these additional monies and we find other monies out there that are available, we will buy as much Narcan as possible, and we would definitely put 2 doses in the kit. As I said, it's a very simple process. The rescue breathing, 1 or 2 regular breaths every 5 or 10 seconds. All right, 5 to 10 seconds. If there's no response, then you administer. It's 1 simple shot in the nostril. All right. It's nothing that you used to have to put the machine together, which some people found confusing. Now, simple little thing, you just push it and it administers the dose, all right? Again, should respond within 5 minutes. If they don't, they suggest, and the EMTs are not there, they suggest a second dose. I've heard horror stories out there that some people, it'll take 3, 4, maybe 5 doses to respond just because of the types of drugs that are out there on the street. It's a horror story. It is an epidemic. It is something that we need to address. If you look at that first thing on there, you'll see that we go back to 2013 when Governor Christie first addressed the issue. So we've been fighting this fight now for 5 or 6 years. We will continue to fight the fight, because, as I said when I told Jakarta to justify what are we preventing here, this isn't prevention education, we're preventing people from dying. So I think it's extremely important.
Yeah.
One of the things that I know the Freeholder Board had talked about is being trained. I can't do a training with you all together, because if I have 5 or more of you together, it's a quorum, and of course we'd have to advertise it before we did it. But we're more than happy to do trainings. If I have 4 or less people, and even if I have to do 2 or 3 trainings, we can do it right upstairs in the conference room on the 3rd floor. Now, one of the things that we just initiated, and it's in conjunction with what's been done in other programs, yes, you would receive a certificate of attendance, all right? And basically it certifies that you have attended the New Jersey Opiate Overdose Program training on naloxone administration presented by the Atlantic County Division of Public Health, funding provided by the New Jersey Governor's Council on Alcoholism and Drug Abuse, and the New Jersey Division of Mental Health and Addiction Services. And we would present that, as well as anyone who is trained would get a kit. As I said, right now, the only thing about this that makes it nice, fit in your pocket, fit in your coat, fit in your purse, whatever, but right now it's single dose. If we're able to get more money available and we're able to buy more Narcan, we certainly would expand the size of this pouch and include a second dose. So, short, sweet, to the point. I hope that what I presented made some sense. I'm open to any questions at all that you have. And again, I thank you very much for inviting us, because
Thank you, Bob. I know you and I have talked about, you kind of ran down a list of some of the things that we do. You and I had talked about putting something together for the county that's similar to the governor's worksheet that he put out with all the state services. We talked about doing that, outlining county services, because that is a question that we all get numerous times, whether it's people just asking to know what do we do, or to be able to give it to them and say, here's all of our resources if you're experiencing an issue. So I'd like to continue us working on that.
okay.
I'm sorry, I saw there was a number of hands, so.
I was
Like,
trained, within the.
I'm sorry, I'm going to move
No,
forward
that's
because I have
okay.
hearing aids.
So I was trained, but I think it's always good to go back, so you don't have a problem going back and you're restating everything that I went through the first time, so I like it.
Yeah, we realize that, and some things have changed. As I said, the old ones, you had to put the injector together, which some people found very confusing. The rescue breathing is new. So yes, we would certainly invite anyone to come and be retrained and get a newer kit. So.
Great.
And how long is it till it expires?
Actually, I think they're good for 2 to 3 years.
Oh, okay.
So, if you look on the packet, it actually gives you an expiration date on your
Okay.
packet. your Narcan packet.
Freeholder Risley?
Yeah, thank you. You said the two-dose one is about $75.
Yes.
So the one you're showing us with a one-dose in is
Well,
less or?
when it comes to us, John, it's packaged in a double dose package. We take it apart,
I see.
you know,
I
and the
see.
double dose package, which is standard, is $75.
Okay,
So,
no, I got it. Thank you.
Any other questions from the board? All right, thank you so much,
well,
Bob.
thank you very
and-
much. I certainly appreciate it, and I thank you for having us here. And as I said, I wanted to introduce my new people so you know them, and hopefully we'll get this thing. Pat Diamond is also here, our department head, and I told her I want to definitely try and get things back up and running by the end of March, so, you know.
And he
we'll
will,
continue to
knowing
work.
Bob, he will.
Yes, he will. And welcome to our two new folks. It's great to have you guys here. Certainly some big shoes to fill, but I know you will, so that's great. So thank you so much, Bob. We really appreciate it.
You're quite welcome, thank you.
Okay, yes, Freeholder
Let
Dorsey,
the
welcome.
record reflect that I
You're here?
have arrived late,
You have arrived.
but I'm here. And excuse my
Glad
lateness.
you're okay.
I'm behind the clock, so you know what that means.
No problem.
The second thing is,
You're pulling a Rich Dates, that's okay. Uh-huh.
Also, let me tell you before Bob leaves, Bob, I gotta be honest with you, that's the first time in 6 years I heard you talk that long. I didn't know you could talk, but I enjoyed that.
Thank you very much.
Thank
you.
Thank you.
Thank you.
Okay, before we move on with the rest of our agenda, I think we had a request to move item 100 up to our next item, because we do have guests here associated with that item, so do we have a
So
motion?
I would like to make the motion to move resolution number 100 up.
Move. Second.
Okay, motion and a second. Sonia, do you want to read that one?
Sure.
Sorry, I'm kind of skipping around.
No, that's all right. Resolution encouraging and supporting a Dementia Friendly America and New Jersey involvement, sponsor Maureen Kern.
Okay, if there's no other questions, all those in favor?
Aye.
Any opposed? All right, so that moves it on up. So with that, we'll invite our guests up. Maureen, do you want to
Yeah, I
kick it
just
off?
want to, first of all, I want to applaud Carolyn and Mary Beth for their efforts here. What they're doing is, there's a program called Dementia Friendly America that they are bringing to our county. They had their first meeting, I'm going to let them speak about that. They had quite a few people from police departments throughout the county come, and 26 to 30 people actually attended the first one. They needed support from local leadership is one of the criteria in order to use a lot of the information with this. It's called DFA, but it's Dementia Friendly America. So Carolyn and Mary Beth, if you'd like to come up and give us a little.
Thank you very much, everyone.
Welcome.
So, my name is Carolyn Peterson. I work for Right at Home. I do a lot of work with seniors and those with dementia. Mary Beth Lewis is from the Alzheimer's Association. And both of us, for many years, have seen, and as all of us, the increase in Alzheimer's disease dementia across our cities, our counties. I am a support group facilitator. I facilitate memory cafes. I see more and more people with younger onset who can't work, but they can't really do anything. I mean, going to a simple gym, when you hear stories you don't think about it, or even going to a gym, they're in an exercise class and, you know, the instructor is correcting them and, you know, trying to tell them that, you know, to do this, do that. And it's frustrating because they don't want to have to tell everyone what their disease is. And we just thought that training people and training the community across sectors and bringing more awareness to this disease would be a great benefit, especially to New Jersey. So DFA is a national network of communities. It's organizations and individuals seeking to ensure that communities across the U.S. are equipped to support people living with dementia. It was started in 2015 after the White House Conference on Aging. It was based on Minnesota's statewide initiative, Act on Alzheimer's. It was piloted in Denver, Colorado, Santa Clara, California, Maryland, Tampa, Arizona, and in the state of West Virginia. There are currently 34 states across the country involved in Dementia Friendly America. New Jersey is not one of them. Just so you know some statistics, There's over 5 million people in the United States with some type of dementia. 1 in 10 people over the age of 65 have dementia. 1/3 of people over 85 have dementia. And 60% of those live in our community, in their homes. 1 in 7 live alone. South Jersey, okay, the South Jersey counties, we have over 85,000 people with some type of memory issue, whether it's dementia, cognitive impairment. So Mary Beth and I coordinated a task force. We had our first task force meeting a few weeks ago, and as Maureen said, we had 26 people in attendance across sectors. We had legal, we had bankers, we had 4 police departments. We had healthcare, stewards, so we brought people from all different sectors of the community to come together to talk about the issues, to talk about how we can educate their employees, how we can make one of them a model so that all of us are more dementia friendly. And in order for us to apply through the Dementia Friendly America, we need your support, and we need, community support. So that's why we're here today. Thank you.
Thank you.
Thank you very much. I mean, I think it's interesting because of the way you talk about restaurants, how I think you mentioned to me you had a relative that was very uncomfortable going into a restaurant after a while because they just didn't know how long it would take her to comprehend and take in some of the information, even in trying to order. And the same thing with police officers. You went through the 1/1000s up to 90. It takes them, like a minute and a half?
90 seconds. So to give somebody just a simple direction with even a mild cognitive impairment, takes them 90 seconds to process that one little command.
So if an officer stops somebody and says, get out of the car, so it's taking them a while, so it's also training people, first responders, on, to try to recognize and, deal with the situation as well. As well as restaurants and the whole community, so I think it's wonderful. Thank you.
Absolutely. Thank you
We
very
have a
much.
proclamation for you. And we'll get you copies of this too, so you can use it for what you
Thank
need.
you.
While Maureen's making her way down, did any other freeholders have any comments or questions on that? Yep, sure, Ricky.
Just curious, why New Jersey's not involved?
I don't know. In 2016, there is a New Jersey statewide initiative, Alzheimer's Act. And several of the key issues was educating the public, which is being done, in different sectors. Why we aren't involved in the DFA, I can't answer that.
They will be.
We are going to be. Yes.
How does the dementia, the DFA, how does that change conditions in a gym? Or what changes are done to accommodate the cognitive disability?
We want to participate in DFA so that we're nationally recognized as a state that is becoming more dementia friendly. And how we're going to accomplish that is part of our task force, a lot of our task force will go out and actually train. We are all volunteers. People will be trained on symptoms, signs and symptoms, communications and behaviors. And then we also have an immersion where the virtual dementia tour, I don't know if anyone has ever done that. If you haven't, I would highly suggest that you do it, where you actually, it's 12 minutes, and you are garbed, and you go into a room as if you have dementia. It's an unbelievable experience, but it's really eye-opening. So our goal is to start out to have a model police department, to have a model restaurant, because we can't do it all of ourselves,
Yeah.
you know.
A model casino, a model supermarket.
And then from that, other trainings will happen through
So it's more of an awareness
Yes.
to accommodate.
Absolutely.
Well, I think that once we formally pass the resolution, we could definitely send it up to our state legislators and ask them, to consider supporting New Jersey in joining that, so.
We met with Senator Brown.
Okay, great.
He was very much in support of it.
Great.
So he also was going to do a letter for us or something so that, we can submit this to the DFA
Awesome.
to get on there.
Great.
And looking to bring
Get your
Cape May
15
County.
seconds.
Well, So
Yeah.
right now, we're doing Atlantic County and Cape May County. And even that's large. So,
For volunteers, yeah.
you know, but that's where we're concentrating.
Okay,
And this isn't all gonna happen tomorrow,
Mhm.
but every day we're working toward that with the ultimate goal of having our state.
Yeah.
State of New Jersey Dementia.
that's great. You can see the passion you guys have for it.
I do, thank you. We do.
Okay, here, you get, no,
Oh,
do it this way.
Okay.
Two more over here, lady,
Okay.
please.
Paul, the phone's not working.
On the phone.
So as freeholder Kern makes her way up here, can we get a motion to formally adopt the resolution?
So moved.
Second.
Motion and a second. Any other questions or comments? Okay, hearing none, roll call vote, please.
Bennett,
Yes.
Coursey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. Thank you, ladies.
Thank you very much.
All
Thank
you're
you very
doing.
much. Yeah.
Thank you. Okay, moving on to the rest of our resolutions now. 88,
Professional services agreements with various veterinarians and veterinary offices for the provision of veterinarian services for the animal shelter. Amount not to exceed $52,000.
Moved again. Moved again.
okay, we have a motion and a second. Any other questions or comments? Any comments from the public? Hearing none, roll call vote.
Bennett,
Yes.
Coursey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 89,
Competitive contract with Baron Jewish Older Adult Services for nursing services to include physical health and education, amount not to exceed $36,000.
Motion.
motion
Second.
second. Any questions or comments from the board? Anything from the public? Roll call vote.
Bennett,
Yes.
Coursey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 90,
Competitive contract with Atlantic Care Regional Medical Center to provide services pursuant to the Older Americans Act, amount not to exceed $50,000.
Motion.
Second.
motion and second. Any freeholder comments? Comments from the public? Roll call vote.
Bennett,
Yes.
Coursey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 91,
Bid contract with Wasaki Electric, Inc. to furnish and install an emergency generator at Lenape Park East, amount not to exceed $320,591.25.
motion and a second. Questions or comments? We did discuss it. This is the actual approval. Right. Okay.
Risley informed me.
Okay. Any comments from the public? Roll call vote.
Bennett,
Yes.
Coursey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 92,
Bid contract with Lafayette Utility Construction Company, Inc. for replacement Lenape Pump Station, amount not to exceed $193,844.70.
Second.
motion and second. Any further questions? Comments from the public? Hearing none, roll call vote.
Bennett,
Yes.
Coursey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 93,
Bid contract with MCH Equipment, Inc. for providing washer and dryer replacement at Meadowview Nursing and Rehabilitation Center and the Atlantic County Justice Facility, amount not to exceed $157,512.60.
Motion.
Second.
motion and a second. Any freeholder comments? Comments from the public? Roll call vote.
Bennett,
Yes.
Coursey,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 94,
Agreement with Center for Family Services for the provision of meals to the occupants and employees of the Center for Family Services Youth Shelter located in Northfield, revenue generating in the amount of $58,800.
Moved.
Second.
motion and second. Any freeholder comments? Comments from the public? Roll call vote.
Bennett,
Yes.
Bertino, Coursey,
In
sorry,
absence of Bettino, yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 95,
Confirming disposition of county interest in a portion of the right-of-way of Brigantine Boulevard, County Route 638, that is not necessary for county purposes to the owner of adjacent property identified as Block 301, Lot 1 in the city of Brigantine, revenue generating amount $14,750.
Moved.
Second.
motion and a second. Any freeholder comments? Comments from the public? Roll call vote.
Bennett,
Yes.
Corsi,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 96.
Interlocal agreement with the Atlantic County Improvement Authority for project management services for the Community Development Block Grant Program ADA renovation project to the Estelle Manor Park Nature Center, amount not to exceed $4,500.
So moved.
Second.
Motion and a second. Any freeholder comments? Comments from the public? Roll call vote.
Bennett,
Yes.
Corsi,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 97.
Memorandum of Understanding with the Hanson Foundation, Atlantic Care Foundation, and the Atlantic County Sheriff's Office to purchase, equip, and paint the Hope One mobile unit, amount not to exceed $40,000 for a 2-year period.
Motion.
Second.
Motion and a second. Any freeholder comments? Any comments from the public? Roll call vote.
Bennett,
Yes.
Corsi,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 98.
Appointment of Nandi Singh, Tori T. Garvin Sr., and Marianne McGee Gallo to the Atlantic County Workforce Development Board for a term to expire on March 1, 2022.
Motion.
Second.
Motion and a second. Any freeholder comments? Comments from the public? Roll call vote.
Bennett,
Yes.
Corsi,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 99.
Reappointment of Frank A. Lucarelli to the Atlantic County Construction Board of Appeals for a term to expire on January 1, 2023.
Move.
Second.
Motion and a second. Any freeholder comments? Comments from the public? Roll call vote.
Bennett,
Yes.
Corsi,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 101.
Resolution encouraging and supporting South Jersey Transportation Authority's new incentive program to airlines using Atlantic City International Airport, sponsor Amy L. Gatto.
Move.
Second.
Motion and a second. I think everybody's aware. We saw the article of what the Transportation Authority is trying to do. Any other questions or comments? Any comments from the public? Roll call vote.
Bennett,
Yes.
Corsi,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gatto.
Yes. 102.
Resolution calling upon New Jersey Transit to complete its activities to return the Atlantic City Rail Line to service and provide a schedule of the date or dates when those activities are expected to be accomplished. Sponsor Ernest D. Corsi.
Move.
Motion. Second.
Motion and a second. Any freeholder comments? Any comments from the public? Roll call
Aye.
vote. Oh, sorry, freeholder.
Absolutely supporting this. I was in touch with Barbara Lazaro. Many of us met at the Atlantic City Rail Station. And it was stated, as we suspected, the tracks are ready. The sensing equipment is there. The fact of the matter is, the positive train control is ready on the tracks. Admittedly, there is a lack of equipment, which means there is a lack of running engines. Some cars still need to be modified in our area for carrying passengers. And there's a lack of engineers and maintenance workers. So my question was, well, what happened to the engineers, maintenance workers, and cars and engines that were here before we got the federal mandate? And there was no answer to that. And there are only 2 sections of track that are not completed. One is called the Princeton Shuttle, the other one's the Atlantic City Rail Line. So it's unacceptable. We need to make more noise about it, and it's affecting business in Atlantic City. I think Freeholder Fitzpatrick can tell us better that the gate shows are suffering because people will come down to the beer festival on the train are not there, which means there's less tickets sold at the gates, which means that there's less success by the promoters, which means they're not going to come back. So it's affecting our convention business, along with the inconvenience to local 54 workers, along with the bread business. Oh, I should have said that. Anyway.
Bread's good.
Anyway, it is a general problem that that everybody wants to ignore. And I recommend anybody to get a hold of John Del Coley's office. I'll give you the number to get a hold of the director. And Chris Brown's been working on this, but he needs some support. And we just need to get this louder and louder because they're going to let us sit here until we are hurting worse.
Yeah, thank you, Freeholder. Nor'easter Nick Pittman, has a bus going up to Trenton tomorrow for, I think it's the Transportation Subcommittee meeting, which is the audio that we heard of them saying a couple weeks ago that, it's not coming back until second quarter, so you can find all that information right on his Facebook pages. If you're interested in going up with him tomorrow too, couldn't agree with you more. We need to be louder and louder and louder. I don't know why this isn't blowing up more. It's unbelievable to me. I'm sorry.
Madam Chair?
Yes,
Are you going?
I'm going, it's in my plan too.
Is that a yes or no?
It's in my plan. I'm figuring it out with work.
This is work.
I understand you.
Is that the reason?
I'm
I'm
figuring
just-
it out with
I'm-
the job that pays the mortgage.
Yeah, this one pays half of it. But I was being facetious. The only reason I'm asking that question, if in fact somebody does go up, they can take this resolution with them.
Absolutely, yeah.
Perhaps read it to the committee, blah, 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 blah.
Mhm.
That's the only reason I asked you the question.
Okay, yeah, we will make sure it goes for sure. I also did reach out to the MBCA. I thought we had a missed opportunity at the luncheon that they had to kind of push it there. So I reached out to them and asked them to write a letter talking about how it's impacting the businesses and, the kind of spillover effect.
Sure.
I
Yeah,
think-
Meet AC would be great, yeah,
I think what we need, Madam Chair, if I may,
yeah.
what we should do, and I don't want to put too much burden on the staff, but maybe we need to take a copy of this resolution and send it to each municipality in Atlantic County.
Absolutely.
And urging that governing body to do something similar to this, and then, send it to our assembly and our senate people, and just send it up to New Jersey Transit. Because if all the municipalities are sending letters and resolutions, they gotta get, somebody's gotta get their attention. I mean,
Yeah.
Frank's been there, you've been there, we've sat around the train station.
Yeah,
If the feds are saying you can open it,
right,
come on.
yeah,
Tell me you don't have enough engineers, I get that, that's a safety issue, I got it.
Yeah.
If they say the lines are ready to open, and
Yeah.
somebody's pontificating, we need to know why.
right. Or give us the dates at least. Give us.
They gave us dates,
give
they
us-
just hadn't met them yet.
Give us the actual tasks. I mean, maybe it's a project manager in me, but give me the tasks and give me the dates. Don't just keep giving us excuse after excuse. That's what is killing me, is the.
It's a whole lot nicer than
pontificating.
North Jersey, that's the problem.
Yeah. We go to Risley.
Thank you. What's frustrating about this is that they know exactly what it's doing to our economy. I mean, a child can figure this out. Why should we have to write stuff? And this is so obvious.
Yeah.
It's just frustrating. It's obvious that business is going to be hurt in Atlantic City. It's obvious people are going to be missing work. It's obvious that sales are going to drop. It's so obvious, and yet we have to, write little letters and this and that, and it's just disgusting, quite frankly.
It is.
I know Van Drew is trying to do something with it too,
That's true.
and trying to bring some more attention to it, but what happened to the engineers? What happened to the staff? They probably went north, like everything does in the state.
Yep.
It goes north.
Freeholder Fitzpatrick, sure.
So, last summer, I went up, and I think I mentioned that I went up and testified at the Transportation Committee. And they were so, not the committee, the Board of Directors of New Jersey Transit was so cavalier and condescending toward us, like we were annoying.
Yeah.
Because we want what's coming to us as taxpayers in this state. And that's decent public transportation, which we do not have. The train was the minimum that we could possibly get by with. We don't have sufficient bus service. The train didn't run enough. And now they are just not only ignoring us, but telling us things that they know are not so.
Right.
And it's just incredible to me that public officials can get away with this.
Yeah.
It's just
Agree.
incredible.
Agree.
It's New Jersey,
I'm not gonna accept that as an excuse.
but that's what it is.
Okay, any other freeholder comments? Okay, any comments from the public?
Thank you, Madam Chair. I don't want to belabor this. I don't know if this is insulting or if it's an opportunity, but on February 7th, the Senate Transportation Committee, chaired by 18th District Senator Patrick Deegan, I think it is, passed the Senate Transportation Committee, Development Commission, the Gateway Development Commission, which express purpose was to increase New Jersey rail transit, commuter capacity. From Penn Station into New Jersey, the Morris and Essex lines were used as examples as a major reason downtowns like Morristown, Madison, and South Orange are now thriving. This backs up entirely what Mr. Risley just said. It dovetails nicely what Mr. Corsi said, and if this is in fact an opportunity, this would be either Minority Leader Kane is the ranking member sitting on the committee, and as I mentioned, the senator is from the 18th is the chairman. If you wanted to use their own words against them, or to encourage them, coax them, however you want to characterize it, this is exactly what we're talking about. They get the picture up there. Mr. Risley is absolutely correct that they are using the resources for their own purposes up north, and there is no reason that after spending hundreds of millions of dollars trying to rescue Atlantic City and Atlantic County, that the same theories shouldn't be used down here. So if in fact there is a joint resolution that needs to come out of the General Assembly, I don't know whether that has been put in the hopper yet. Sooner or later it's got to come together before it gets to the governor's desk, but there's still plenty of opportunity for this board and concerned citizens to maybe demand a member of the South Jersey Transportation Authority becomes a member of the commission up there. Right now it's Amtrak, New Jersey Transit, and the New York Department of Transportation are members on that new commission. So,
I think that's a good suggestion.
thank you.
Thank you, Phil. Anybody else? Okay, hearing none, roll call vote.
Bennett,
Yes.
Corsi,
Yes.
Days,
Yes.
Fitzpatrick,
Yes.
Formica,
Yes.
Kern,
Yes.
Risley,
Yes.
and Gaddis.
Yes. That concludes our written portion of our agenda. Do we have any reports of special committees of the board? Yes, Vice Chairwoman.
With the Mental Health Advisory Board, they usually bring a speaker in each month, and really some good information, but they had somebody from America Works of New Jersey. They were talking about 2 programs that they have there, again, you know, jobs, and this is a great program. One is for people with disabilities. Some people, even through mental health, may find that they're feeling better, they can go back to work, and this is a way that they can get in and get back to work. They also have the youth program, which comes through us in the county, with the One Stop. So the one's called a Ticket to Work for people with mental health, and then the youth program. And they certify them. They don't just, you know, they go to training. First of all, they try to get them their GED. And they'll help them with transportation to these programs. They'll certify them in, you know, job security, things with restaurants and hospitality. So they try to make them very employable and help them get a job. So we hope people that use these. And again, it's America Works of New Jersey. And the office here is on the Black Horse Pike in West Atlantic City. So we have an office right here that really can help some individuals that need to get to work.
Great. Any other reports of special committees? I attended the Women's Commission, had some very fascinating conversation on human trafficking. The meeting prior, they had talked about it from the prosecution side. This meeting, they talked about it from the defense side, which was very interesting. Had a defense attorney there. So it really gives you a lot of different perspectives, but great work happening there. We have some things in the works for Women's History Month that we'll talk about at a coming meeting. All right, any unfinished business? Seeing none. Any new business? Seeing none. Written communications and petitions. Seeing none.
Oh, actually.
Oh, yes, Freeholder Formica.
We did have a written communication from Senator Mazzio, who would like to come in and discuss his ideas on countywide assessment. And I think that we're going to entertain that at a future meeting. Madam Chair will pick it out, and we'll try to listen to what he has to say, which is what we asked him to do before he let out of committee, but it's out of committee, and we're going to have a chance to review it, so I think that's good.
If I may, Madam Chair.
Sure.
Also, I've had this conversation with Mazzio a couple of times also, but I think we made it very clear when you said as the chair, we don't want it to turn into a dog and pony show. We thought we were going to go to committee first to discuss some of the issues, and at some point in a public setting, And I hope we stay on that course, and we go into, to the committee. And we never discussed to do public dog and pony show.
Well, he's offered to come to a meeting, so
We offered to,
come to a meeting.
we offered to come to a committee meeting.
Well, I think it should be aired out.
It can be a committee meeting, Chair, but let me refresh your memory. I know you're a very astute young man. When you was chair, I made it very clear that we should have him come before the committee first, and then we could discuss it in a public setting, and you had agreed to that. And I think we should still keep that same.
I'm not the chair anymore.
It doesn't matter. It was under your administration, and we.
I remember the conversation.
And I
Yeah,
think, all fairness, I think that's what we should do. And there's nothing to hide, but all due respect, come on. We know it's an election year, it's a silly season, and we're not gonna sit there and start the finger pointing. And, you know, I think John Grizzly, and I said this and before, I think he raises some good points. There's some things I'm still not comfortable with. I think it was you who mentioned that you went up to the committee meeting.
I did.
And we were hoping that he was gonna pull it, but he didn't. In the meantime, you know, he agreed that he would come before the committee, and I think we should do that.
Okay.
And I think it
So
should
we'll
be sooner.
send him the courtesies
Yeah, I think it should be
that,
sooner rather
we
than
didn't
later.
get? Okay. Okay. Well, we just got the letter, so we can figure out how we wanna deal with it. But thank you for bringing it up.
It's funny, Frank, you would bring that up. I just had this conversation with him again on Sunday. I said, when are you coming? I'm waiting for the invitation.
Okay, we got it, so we'll figure it out. All right, public comments. Anybody from the public?
See no one from the public?
The one gentleman from the public. All right, seeing none, we'll close public comment. Go to the order.
Good day.
I got two things, or a couple things. First of all, February 10th was the 99th anniversary of New Jersey's ratification of the 19th Amendment. It's a very exciting time for, I think, us as women going into this next span where we get to the 100-year mark, and just a very proud milestone to continue to celebrate. And the next one is it's Black History Month, and just want to remind everybody to continue to take the opportunity for the many things that are going on across the county. I would really love to commend Sonia Harris. I had the pleasure of attending her event with the Lynx at the Noise Garage. What night was that, Sonia?
What did you call
It
it?
was Saturday.
You said the Noise Garage?
Oh, I'm sorry, what's it called?
It is called the Noise Arts Center.
Arts Garage. I'm sorry, I forgot the word arts. Anyway, it was Saturday night. I was there.
I know you were.
I didn't see anyone else, but anyway.
It doesn't matter. I saw you.
It was the 50th annual Black Arts exhibit, and they had a really interesting artist there, Christopher Fabar Muhammad, who really had a very engaging speech and talk that he had with everybody. But Sonia, I know you chaired that committee, and you and your team kind of put all that together, and I just think you should be commended for the work you did, because it
Thank
was
you.
a lovely evening.
Thank you.
Lots of good fellowship and snacks, and maybe a little bit of wine and some art. Really
More
great
wine
stuff.
than art.
You know, in the eye of the beholder. Anyway, anything else for good of the
I
order?
just want to, just to piggyback on that. Dr. Hunter from the South Jersey African American Cultural Heritage Museum visited my school last week. They have actually two traveling programs, but with the help of Stockton University, they have a whole new program that focuses on Atlantic City, South Jersey, and New Jersey history when it comes to the African Americans in our area. And the posters, they were impressive. I mean, it was educational, it was enlightening. I mean, our administrators came through and were just shocked at the role that even, Atlantic City, with the first Miss Black America contest in Atlantic City, it's just an impressive display. So that's also at the Noise Art Garage. So if you can take a look at that. It was, like I said, really enlightening to see the history that our area played.
Yeah, great.
Actually, Mr. Hunter does an outstanding job.
He's incredible.
Putting all that together and collecting data.
Just to see his passion and excitement.
I think every now and then,
trains.
if you go there, you might find some Famika Sepros in it too.
Just the training the student council members, and he was, exact, make sure they knew what they were talking about. and the students were presenting the posters to the class that visited the library.
Does a good job.
Yeah,
That's
very
awesome.
passionate.
Great. Anything else we'll go to the order?
Motion?
Freeholder from Mika?
Just one thing, the Arts Garage, the Noyes Arts Garage has a lot of African-American events. Ralph's going to actually have the Secretary of State down. I'm looking for the date, I can't find
It's
it.
Thursday, 11:30.
See,
There you go.
Thursday, 11:30. And there's also a poetry, African-American poetry, so go on the website, look at that. There's a lot of good things there.
There's a lot there. It's really
And
nice.
I think it's just a great example of, he does phenomenal work, that's all I can tell you. Ralph does phenomenal work, so.
Great. All right, anything else? We'll go to the order. Hearing none, can I have an motion to adjourn?
Second.
Motion and a second. All those in favor?
Aye.
Any opposed?
Opposed?
Nay.